This is a small demonstration on how viruses spread from one surface to the other after we sneeze or cough. So Dr. Chakri is here to demonstrate us how these viruses can spread.
Okay, Rachel. So I think nobody has done this before, so it's just a way to explain to our viewers how when we cough and sneeze, how those droplets land on the various common objects that we use in a daily life, and how it spreads from one person to another person. So hopefully viewers will understand how the virus spreads. So first, I'm actually wearing a gloves, but these are my hands. I'm not assume that I'm not wearing anything. These are my hands, and I'm going to cough then and sneeze, and I'm going to use my hands to protect my nose and throat when I'm coughing and sneezing, which means those droplets are actually coming onto my hand. And if I don't wash my hands after that, see what happens. So to demonstrate this, what Rachel is going to do is put some sprinkle some artificial color like paint on my hand, so people can see it very clearly and assume that this paint is like a virus. You can just
So though the virus is invisible, we just to demonstrate, we are showing and keeping some color on the hands. I'm sorry if I drop some on your shoes and clothes.
Okay.
This probably will remind us of our kindergarten days when we used to paint.
Yeah, that's fine.
Is that enough,
Yeah,
or do you want more viruses?
No, that's fine. So, okay. So although it's a little bit more, but this just to demonstrate. So this is a little bit more, but this is an example. So now I'm going to cough and sneeze. Look, and I'm sneezing. So now that virus, whatever cough, the droplets, the virus, everything else is on my hands. Now I'm not washing my hands, and I've completely forgotten about that, but I just go and do my normal things, like I go and I touch my pen, for example, and I write something, and I touch the paper, and I'll pull this. I'm going to touch my phone and see what's happening. I'm going to check the messages on the phone, see what's happening.
Can I offer you some water?
Oh yeah, sure. I'm just going to drink some water, and
Probably, do you need some more water?
yes, please. Thank you very much. And I'm going to use this for water. And hey Rachel, hi, nice to meet you. How are you? Actually, nice to see you. Right, and met my friend, giving shake hands there, and this is all done now. So I've done my bit of spreading the virus to multiple places, common objects like the phone, the books, the pen, the bottles, glasses, and even spread to another person directly by shaking hands. And now let's see what happens when a new person comes and touches these objects, right? So I'm going to take this out. So now I'm a different person. I'm not the first person. I'm a different person, and I'm just coming, and assume Rachel is not here. I'm coming, and I want to drink the bottle. So this bottle is here. I'm just going to touch this bottle again, open this, and drink some water, and then close it, right? And then guess what? The paint is on my hand. You can see some red dots and red bits on my hand, and I'm just going to wipe my face, do like this. Where is the virus now? It's on my nose, it's in my face, and I'm giving it 3,000 opportunities. As I said before, an average person touches their face and nose up to 3,000 times a day. So that one was not enough. Then I can take this other glass that was touched before, or maybe this pen that's in my office, which was already touched by another person before that infected this with the virus, or in fact colonized this with the virus. I'm touching that pen, and all that is in my hand, and I'm just rubbing my nose and my mouth, and that virus again has another chance to get into me.
If you can observe, this is less than 5 minutes, and so many objects have been touched, and so many opportunities to go inside our respiratory system. So this is a very easy but understandable demonstration on how viruses spread. Thank you, Dr. Chakri, for sharing this. So you need to be really mindful of what you touch and what you use, and as we have told repeatedly, follow hand hygiene. This is very important. Hand hygiene is a must. Till we meet again on more updates on COVID-19, thank you so much, and God bless.